Good afternoon, everybody. My name is Steve Federico, and I'm the Director of General Pediatrics at Denver Health. Appreciate everybody taking the time to join us today. We are indeed very excited to announce the work that we've been doing jointly between Denver Public Schools and Denver Health to build the infrastructure to be able to adequately test all symptomatic students in Denver Public Schools through a no wrong door approach. So we worked really hard to build the infrastructure with our community health center sites, as well as our school-based health center sites, so that every child, when they become symptomatic, can reach out to us through a number of different venues to be assessed by a clinician and to have a COVID test ordered when appropriate. The primary way we're doing this is through our school-based health center system, and families can call us at 303-602-8958 and be immediately scheduled into a telehealth visit with one of our school-based providers who will do a quick assessment for whether or not the kids and the students meet criteria to be tested, and to then have a scheduled COVID test done at one of our drive-up sites. And we've strategically built drive-up sites across the city, at our Pena Clinic here on campus at the hospital, at our Montbello site, and we're soon to open one at our Lowry site as well. Geographically diverse sites, making it as easy as possible for all of our students and our Denver Health patients to be tested in a timely manner. The idea, of course, is to maximize in-person learning and to keep our school buildings safe and to have a successful return to school as we've returned our elementary school students gradually back to in-person learning. We want to make sure that whenever somebody is symptomatic, they're not attending in-person school. And in order to get them back as quickly as possible, we want to assess their risk for COVID. And when they are safe, get them back as quickly as possible. The other thing this allows us to do is minimize exposure to students and staff. One of the things we've been most concerned about as it relates to in-person learning is the quarantine scenario. When you do have somebody who has COVID, you have to do something called contact tracing and find out who's been in their immediate circle and ask those folks to quarantine up to 14 days. And so obviously, if we can minimize the number of students that we have in the school buildings with COVID, that greatly diminishes the number of other students and staff that have to be quarantined, which allows those classrooms to stay in person and functional for as long as possible. So we're super excited to create this partnership, and it's an extension of our 33-year partnership that we have between Denver Health and Denver Public Schools, where we've been providing services in many Denver Public Schools. And so we're super excited to launch this new chapter and our joint response to the COVID pandemic in 2020. So I'm happy to entertain questions, but that's essentially the backbone, and we're super excited to do our part to work in solidarity through this pandemic.
Thank you, Dr. Federico. Okay, we would be happy to open it up for question and answer. Okay, Emily Allen with Fox 31 has a question. Go ahead, Emily.
Hey, yeah, so I have a quick question for you. I just want to clarify, so this testing won't actually be done on school property. They'll do the assessment potentially on school property, and then they'll get tested elsewhere. Is that correct?
That's the primary way it will be done. That's correct. So most of it will be done through a telephone visit, telephonically, which is the primary way we're doing assessments for symptomatic patients. We do have in-person school-based health centers functioning currently at 18 different Denver Public School sites. They're mostly in our high schools and middle schools, which do not have a lot of students, as you all know, currently. But if we had a student in one of those buildings who was already there and they were found to have symptoms, they could be assessed on site. But the primary mechanism that we envision this happening is via telehealth visits, again, to minimize the exposure to other students and staff.
Great, and I have another question too. My second question is there going to be a limit on the number of COVID tests available? I just feel like we often hear about these awesome things, and then there ends up being some sort of daily limit on how many can be done in different capacities.
Yeah, no, fair question. And like most sites, we've worked really hard to build up our testing capacity since March. I mean, it was a huge dilemma early in the pandemic. We've been fortunate to be able to grow our infrastructure quite a bit, but there are limits. And so we actually at this point can only do symptomatic students. We don't have enough capacity to do the contact tracing. And so for that, we're relying on our public health infrastructure and having to refer out to other sites to do the contact tracing. So those are the students and or family members who are exposed to somebody who has COVID, but they themselves don't have symptoms. And currently, testing those contacts is important, but it actually doesn't change the return to school guidance based on the recent CDPHE guidance. If you've been a close contact of somebody with COVID, you're actually asked to stay out of school for 14 days, regardless of whether or not you've had a test or not. So it's less impactful on the number of in-person learning days that a student can have. Although contact tracing remains important, our primary focus at this time is to test kids and students and our patients who are symptomatic.
I just want to address that getting our kids tested when they need to be tested, as well as the testing that we are offering to our staff, is truly going to keep our community safe and help us identify needs. And so that is our top priority, is keeping our school community safe, including our staff and our students.
Great, thank you. Do we have any other questions?
Okay, me again, one more quick question. Sorry, the lights keep turning off, by the way, in this room I'm in. So my last question is, will you just explain a little more about what these school-based health centers are? I'm not familiar with what that is.
Oh yeah, sure. So for 33 years, Denver Health, in partnership with Denver Public Schools, has operated a growing number of school-based health centers. And what they essentially are an extension of our primary care network. So we build small primary care offices inside of a school building, and they're staffed with a nurse practitioner or a physician assistant, a medical assistant, and a mental health therapist, as well as now counselors who focus on issues related to substance abuse in some sites, and other health educator staff, including staff that help enroll families into health insurance when they're uninsured. And we provide most of what we can provide in our primary care setting. So we can see kids for sick visits. We do a lot of child checks and physicals. We provide the full complement of child and adolescent vaccinations, including flu shots at these sites. We can assess kids for acute illnesses like strep throat. We can also dispense some medications. We have some antibiotics and basic asthma medications that many of our kids need. And so the idea there, again, outside of a pandemic, is to maximize the amount of time that kids are in school and allow them to go and have their healthcare appointments done efficiently and get them back to school as quickly as possible. So the last few years, we've seen nearly 12,000 Denver public school students through this infrastructure, providing them with the majority of their primary care needs right on site.
And all of our students in Denver Public Schools have access to these school-based health clinics. There is no charge for families out of pocket or anything like that. And so it is an incredibly valuable resource for our families. And if any families need information on school-based health clinics, I want to encourage them to reach out to their school nurse, who will help get them contact information and anything that they may need. But it's a really, really valuable resource for our DPS community and students.
And Emily, this is Rachel Hirsch, the PIO at Denver Health. Kim Posey actually did a really fantastic story on our school-based health centers. I want to say in June or July of 2019, right before my son was born. And it's a really fantastic package. It was primarily about the mental health and behavioral health services we provide, but she did a really good job of covering that we have dental, that we have all of these other things. So I would encourage you to look at that piece from Kim Posey. I can send it to you after this too as well, but Fox 31 did a really nice job with it. I remember that one very specifically.
Yeah, it's incredibly valuable. You're right. One of the parts that we, I think, tend to overlook is the dental piece, and oral health is such an important component of physical health. And the dental piece is amazing that they provide there. So yeah, incredibly valuable resource for our families.